here at need, I'm down at the bottom of the triangle working quite biochemically. And I like that because it's all important. Like we need to be working at all levels. Like we can't just go to the gym only and be well, right? We can't just take a bunch of vitamin D and be good. Like we need all of the levels to be addressed if we really want to be healthy. So what we call musculo-skeletal repair or biopuncture, sometimes known as neural therapy because of one ingredient that I'll mention in a second here. So these injections are subcutaneous. So that means they just go in the very top layer of the skin over wherever the pain is. So these are used for pain of any kind. It doesn't matter origin, tissue, duration, frequency, or how long it's been going on. It doesn't matter, just pain in general. And what these remedies are, so these are natural remedies that are formulated. I have maybe 20 different versions of these remedies in my kit. So I make little recipes for each patient. So maybe for one, I'm going to be like, oh, you need the cartilage one, you need the lymph one, and also the circulation one or something. And I can like make special blends for people. What these remedies are doing, so they go into the skin just very superficially, they get absorbed into the lymph and the blood. So it's going to go in, and basically what these remedies are doing are letting nutrients get right inside cells so that healing can happen and letting waste out of cells. So it's very, very sort of targeted cellular therapy. And sometimes with patients, I'll have this kind of 4-step approach where if you think about painting a room, like first you have to, what do I do first? First you have to like fill the holes and sand, and then you wash, and then you tape, and then you're ready to paint. So I'll start with just like lymph drainage. So we're going to start to move kind of like the tissue in terms of getting their tissues around the area clean. And then I might go into like, okay, now we're ready for like the joint piece. And then the final layer will be like the actual remedy that gets right into the cell. So I kind of like sometimes go in this sort of stepwise approach. Procaine. So I include procaine, which is a local anesthetic, as long as there's no allergies to procaine. And the benefit of procaine is twofold. When we use procaine, obviously there's a numbing effect that happens. So within 5 minutes, the person's saying, and it's very short acting, it's out of the system in about 30 minutes. So within 5 minutes, the patient's like, oh, like, it feels better. So A, there's an immediate benefit, and B, now that I've kind of formulated this idea of well-being and the levels, there's this like psychological benefit that happens as the pain signal isn't getting to the brain anymore. There's this like hope that happens up here, this like relief that happens. It's like, oh my gosh, maybe it's possible to not have pain anymore. So there's this mental nutrient that's going in that's having a filter down effect into the physical and into the biochemical level. So I've been using them for so long and they're so darn effective. What's interesting about them is, so we do these injections, they go away, they come back to me, and they start to, and these are the people like that have had, 20 years ago they had their MVA and they have all their appointments every week. Like these are, these people, right? They have like 5 appointments a week, right, for their chronic pain, and nothing ever shifts. And so they come back to me and finally they're like, you know what, like my physio said that my range of motion is finally improving. Like, oh, okay, cool. Or like my RMTs, lots of RMTs, right? They're saying my tissues just feel softer, or like more supple, more flexible. Cool. The chiro is saying like, oh, the adjustment finally held. And so this is a great example of how this like biochemical approach is actually helping these hands-on therapies work better because of this nutrients in, waste out thing. I typically would start with sort of 4 treatments and then reassess. Sometimes people need as many as 8. Sometimes it's like a cure. And then sometimes it needs some just more attention over time. So the odd time I'll have patients who like come in for like a little bit of a reboot. But it works so nicely hand in hand with other modalities.
So would you do multiple areas in one appointment?
I can. It's
You
too,
can?
yeah.
Okay.
So if there's like hip, shoulder, knee stuff, like, yeah.
You would just touch on all those things
Totally.
in that. Okay.
Yeah, so like why, when I'm so interested in this like mental level, am I interested in this also really tactical, like, nitty-gritty? Because it's all helping. Like, again, sometimes we just need a day where we have energy. Sometimes we just need a day where we can like focus and think. Sometimes we just need a day where we don't have pain. Like, sometimes we just need that. So that's why it all matters. It all matters.
Or is it covered by benefits?
Yeah, yeah.
Okay.
For sure, naturopathic, it's just under the naturopathic umbrella.